Ladies and gentlemen, welcome once again to another episode of the Think Clinical Podcast. My name is Hamza. It feels good to be here. Thank you for joining us every week. If you haven't done so already, please remember to subscribe, like, and share. Just like every week, this week is another very exciting episode, and we will be discussing AI because there's a lot of AI noise everywhere. I have had several episodes here talking about AI in different contexts, and this is an opportunity for me to go deeper into where we are with AI right now, because there seems to be a lot of noise on AI. Everybody is talking about AI, and today I want to tell you something that could be a little exciting, but it could also be very confronting. And as of 2024, just a few data points, 66% of US physicians were using AI tools in their practice. And this represents a 78% increase from just the year before. When you look at this further, 71% of non-federal acute care hospitals had integrated predictive AI into their electronic health records. And the AI in the healthcare market, which is worth about $26.69 billion in 2024, is projected to reach about $613 billion by 2034. So what we are trying to say here is that this is not the future. This is happening right now in this industry, and it's happening around us. So here's the question that should keep you up at night, and this is what I really want us to discuss today. Is it happening to your organization, or is your competitor running this and you're just watching from a distance? Today we are going to cut through some of the noise of AI, because there is a lot of noise, and every vendor who will come to you will tell you how exciting their products are. I've had several conversations recently with vendors who would come in and tell you how exciting their product is and how they want you to, and how much ROI they're going to give to you. Every conference you go now, there's always a panel on AI disruption and what AI means for the future, and all that, and they're trying to just make rational decisions about how to invest their time and state. So this episode is going to guide you in all this noise to be able to, first of all, identify what is working now. That's the first thing. And if you're able to establish what is working now, you can then evaluate how to use AI without getting sold on it, because people are investing so much money, organizations are investing so much money on AI solutions that maybe in the long run, not maybe, that definitely in the long run have no benefit, because they are not considering all the different angles that they have to consider when they are making such decisions. So what's the state now? Let me give you some honest landscape. There are 5 AI applications that every healthcare organization should be looking at now, and these are dominating the healthcare space. So if you look at the 2025 survey data, the top five that you need to be looking at include: 1, you need to be looking at generative AI, which has about a 71% adoption rate in organizations. 2, you need to be looking at speech recognition, which accounts for about 70% of in adoption. You need to look at agentic AI. So now we are in the era where there's a lot of focus on agentic AI, which has about 68% adoption. Now, you just have agents who are running these repetitive tasks that you would have otherwise done yourself, or had a team that would have been doing for you. And you have machine learning and robotics. These are the 5 areas that are really impacting, but those categories are not cases. So let me give you the use cases that are delivering measurable results for organizations like yours. So number 1, and this is the single biggest category by investment, is ambient clinical documentation. So Kaiser implemented or deployed this over 40 of their hospitals and over 600 medical offices. And this was one of Kaiser's one of their fastest implementation of technology in 20 years. And what they realized immediately was that there was about a 40% reduction in burnout rate. So they had an ambient AI system just in the background, and I think this was from a bridge, and which would just listen to conversations that were happening between patients, and it documented everything and helped doctors with the documentation part of it, which takes a lot of time. Now, one thing you need to understand is that AI delivers $3.2 return for every $1 invested, with returns typically seen within 14 months. This is a fact that I want you to keep in your head as we continue this conversation. The second area, so when we move away from documentation, the second area that AI or hospitals are really seeing out of benefit with AI are in coding and billing automation. So when we look at Menlo Ventures in 2025 and in their state of AI in healthcare report, they identified coding and billing automation as a 450 million category, just that alone. And one of the fastest growing because the ROI is so clear and it's so fast. So this is the second area that most organizations are spending their time and they're investing money. Now, number three, if you're in healthcare and you're looking at AI solutions, where there people are seeing a lot of success is in prioritization automation, which means that now you don't have somebody working through or trying to identify all the patients who need prioritization and actually following them through. So you have prioritization requests that are one of the most despised administrative burdens in healthcare, and physicians handle about 45 per week on average at a cost of about $6 to $11 per request to process. So the prioritization AI category just grew by about tenfold from 2024 when you look at a report from Menlo Ventures, because attacking a pain point that is both universal and again extremely very, very, very expensive. So that's the third place that you have to look at. So the first place is to look at AI in the category of documentation. The second one is to look at AI in the category of coding and billing automation. The third one is looking at it in the category of prioritization automation. And the fourth category, and then when you look at this as a measurable host, how measurable outcomes look like for these, you have to be able to pay more attention to some of the ways and some of the case studies that are in the system right now. And I want to get specific with you in real world results, because the AI conversation is in healthcare suffers from too much aspiration and not enough data. So let's look at some data. So when you look at data from Johns Hopkins, you are seeing the integrated AI tools into their scheduling, round support, and appointment systems. The results, their ER bed assignment times dropped by 30%. Operating room transfer delays reduced by 70%, and ambulance response times shortened by 63 minutes. And these are not just soft benefits, these are operational metrics that are having direct financial applications. Okay, so when you look at Mid and South Essex NHS Trust in UK, the AI pilot targeting patient no-shows reduced missed appointments by 30% in 6 months, and it's enabled about 1,900 additional patients to be seen and prevented 377 missed appointments. So in a fee-for-service environment, 1,900 patients, additional patients encountered is pure revenue that you should be looking at. We look at data from Cleveland. And when you look at their AI platform for sepsis detection, the results were remarkable. A tenfold reduction in false positives, meaning clinical staff were no phantom alerts, and a 46% increase in actual identified sepsis cases, with alerts delivered before antibiotic administration in 7 times as many cases. And this is both a patient safety outcome and an efficiency outcome. So now let me tell you about it. Let me tell you about the fact that 80% of healthcare market that Menlo Ventures identifies are still untapped. And so when you look at some of these reports, you realize that there are still a lot of places that people can actually get there. So now the main question here I would need all of us to be able to address is that how do we evaluate AI without getting sold on it, or without getting it sold to us? How do we really look into AI and derive the value that we want from it without that being sold to us? Now, this is basically where most healthcare businesses get stuck, and I can say that in the past couple of months, or when AI really became a big thing and people were venturing into this so much, this has been a challenge that most people have. So if anybody is approaching you and you are even looking or remotely considering any AI solution, there are a couple of questions that I hope you can ask yourself. And if you don't have or you don't get answers to those, you should be very careful with moving on with any AI solution. The first question is to ask about what specific measurable problem does this solve? And basically, what is the cost of that problem right now? Because so if a vendor cannot answer this question clearly, they are selling you a concept and not a solution. So that's the first question you should ask yourself. The second question you should ask yourself, so that you don't get things sold to you, is that what is the integration requirement? Because a lot of AI tools that came initially, and I know that is being fixed right now, a lot of AI tools that came initially will sit alone as different systems, and you find a lot of these your team members having to, first of all, having to log into an additional system every day, but more importantly, they have to also be able to keep track of the training or the specific workflows that are designed, because that system is sitting outside most of your systems. So you have to be able to ask what the integration requirement looks like. And if any AI system is sitting by itself and doing nothing, you have to be able to really identify ask yourself whether that's going to be beneficial for you. The third question you should ask before you even consider any AI system is, what does it look like in what does success look like in 90 days? What does success look like in 6 months? What does success look like in 12 months? You need to ask every vendor what the standard success metrics are and the success timelines. Then you have to ask for references for organizations like yours who have the same architecture that you can talk to and find out how this works. And the last bit of this is who owns this internally, because you have to be able to put someone responsible for this process internally and be able to monitor this. If you cannot answer or you don't get answers to these 4 questions, you need to understand that you are being sold a product. You are not adopting a product that is going to help you. So when you look at this in the long term, the 3 starting points for different business types is that, and I want to be direct with you, because it will depend on the type of organization. If you run a clinical practice, which could be a GP, could be a specialist practice, could be a multi-disciplinary clinic, your highest ROI first investment is in ambient clinical documentation. Again, if you run a clinical practice, which is either a general practitioner office, a specialist, or a multidisciplinary clinic, your highest ROI first AI investment that you should be thinking about is ambient documentation, because the time savings are immediate, the burn rate reduction is measurable, and the adoption barrier is relatively low. So this should be the first thing you have to consider. Now, if you run a hospital or a health system, your highest leverage first investment in AI should be an AI-powered denial prevention in your revenue cycle. That should be your first consideration. Given that the denial rates cost the industry about $262 billion, you should understand that you are a part of that big statistic. And looking at the 65% of denied claims are never resubmitted. If you are able to automate this, you are getting your part of that piece or that data back. And here's the number that I want you to again, I want to leave with you. If you remember the $3.2 number that I gave you, and this is the average return for every dollar invested in healthcare AI, and these returns are typically realized in 14 months, and these are not in theory, these have been very well vetted. If you think about this, then in the third category of people that I talk about, which is that if you run a healthcare tech company, your first AI investment should be in your own product's intelligence layer. Again, as I said, intelligence means that it's telling you why something is happening and what you need to do about it, not what just happened. Okay, so I want to leave you with this, that in an electronic health record era, in healthcare, I mean, this era was basically run by regulations, and the government made it happen and the industry followed. But slowly and reluctantly, more and more expensively, this happened. Now we are moving into a new era of AI, and this is different. It's being driven by competitive advantage, and the organizations adopting AI now are not doing it because they have to. They're doing it because it works, and they're doing it because they know it gives them a sustainable competitive advantage. And you have to be one of those organizations that really positions yourself well. But it's not just a question of jumping into any AI solution that comes your way. It's a question of identifying what would really be helpful to you and adopting it the right way, considering all the factors that we discussed in this episode. So this has been another episode of the Think Clinical Podcast. Thank you so much, and I will see you in our next episode.